Morning, everybody, and thank you for attending today. My name is Casey Payne, and I am a Workforce Planning Employment Strategy Specialist out of Saskatchewan Health Authority in Saskatchewan. Before we start, I just wanted to acknowledge that SHA acknowledges that we are gathering on treaty territory and the homeland of the Métis. Recognizing this history is important to our future and our efforts to close the gap in health outcomes between Indigenous and non-Indigenous peoples. We pay our respects to the traditional caretakers of this land. I'd like to acknowledge that this presentation is being delivered and performed on Treaty 6 today, the homeland of the Métis. So Saskatchewan Health Authority's vision, mission, values, and philosophy of care. So our vision is healthy people, healthy Saskatchewan. We work together to improve health and well-being every day for everyone. Our values are safety, accountability, respect, collaboration, and compassion. And our philosophy of care is our commitment to a philosophy of patient and family-centered care is at the heart of everything we do and provides the foundation of our values. About Saskatchewan Health Authority, so we do have 42,000 plus employees, 2,700 plus physicians, and over 25,000 volunteers. We are Saskatchewan's largest employer, as well as one of the largest health systems in Canada. The registered nurses in the SHA. So we do have over 10,000 registered nurses or registered psychiatric nurses, which contributes to about 25% of our employees. So why work with us? We are a unionized environment, Saskatchewan Union of Nurses, which means we have negotiated processes and set wages and benefits. Your seniority is based on your hire date and will start to accumulate when you commence employment. We offer paid internal training such as perioperative, critical care, renal dialysis, lactation, foot care, hyperbaric are just some examples. And we do have an extensive benefit package, including extended health and dental plan, defined benefit pension plan, life and disability insurance, employee and family assistance program, and annual vacation allowance. I also need to add in, since all my co-presenters here have talked about the beautiful oceans that they have, we do not have that in Saskatchewan, but we are 17 hours from the Yellowstone Dutton farm. So that's a nice sell for us. Right now, Saskatchewan has the most aggressive recruitment incentives out there. Our provincial government has announced effective October 1st, a one-time incentive for hard to recruit positions in rural and remote locations. So $50,000 for registered nurses, registered psychiatric nurses, and nurse practitioners. $40,000 for CLXTs, licensed practical nurse, medical lab techs, medical radiation techs. $30,000 for continuing care assistants, medical lab assistants, and any new grads receiving the graduate retention program. This would be paid over a 3-year period with a matching return for service. This is a huge incentive right now in Saskatchewan. Our government is acknowledging the need for these positions specifically in our rural and remote locations. On top of any of those incentives, we also have the graduate retention program, which is a $20,000 rebate in tuition. You must live and file a Saskatchewan income tax return. Nurses and nurse practitioners would be eligible for the Saskatchewan Loan Forgiveness Program, but also qualify for the graduate retention program. We also have a final clinical bursary that is offered to students in eligible health disciplines that requires the completion of final clinical placement. Some have talked already about the Student Loan Forgiveness Program. Up to $20,000 of Saskatchewan student loans may be forgiven to nurses and nurse practitioners practicing in rural and remote communities. So a community of less than 10,000 people, you may be eligible to qualify for this, up to $4,000 per year to a maximum of 5 years of $20,000. And then, of course, the Canada Student Loan Forgiveness, a community of less than 50,000 people to qualify for up to $20,000 in Canada Student Loan Forgiveness. On top of any of the incentives I've already talked about, we also offer, dependent on location, but different bursaries from $2,500 to $5,000, signing bonuses, as well as relocation in return for service. This is just an example of our current wages for nurses and the description. We have nurse A, B, C, and then nurse practitioners. Saskatchewan does have, as well as Alberta, the lowest cost of living in Canada and some of the most competitive wages on top of our aggressive incentives. We also have grad nurse wages and premiums as well. We have northern incentives, so depending if you would like it to work way in the north of Saskatchewan, there is additional incentives for that, both weekly and bi-weekly allowances. So next steps. So did you know that you can work as a graduate while waiting to write your license exam? You can also start earning income right away while you're waiting to write your exam in a variety of opportunities, including a continuing care assistant, rec worker, assisted daily living rec worker, unit clerk, unit assistant. A big thing also that Saskatchewan offers is if you are hired as a grad nurse, the SHA will reimburse you for both your graduate and full license fees. If you are ready to apply or at least see the opportunities available in Saskatchewan, all of our positions are posted on Health Careers in Sask website. You can view and apply for opportunities through there. You can create a profile and upload a resume. You can set alerts. So if you're looking for a specific location or position, you can do that. I am here today on behalf of the entire province of Saskatchewan for our health authority. So if you're not interested in where the southern part and maybe the northern part, all positions are available on this website. My contact information is there as well. I'd welcome you to reach out if you have any questions or would like additional information. And then this is just all the information I shared today can be found on this website as well under the grad nurse information. Thank you.